Welcome to our deep dive into a condition that affects millions worldwide, ulcers. Whether you've experienced one yourself, know someone who has, or are here to prevent them, you're in the right place. Today, we'll cover everything from what causes ulcers to how you can effectively treat and prevent them. An ulcer is a sore that forms on the lining of your stomach, small intestine, or esophagus. The most common type, a peptic ulcer, affects the stomach and the upper part of the small intestine. But what causes these uncomfortable sores? Well, it's often a combination of factors. Let's take a closer look. A major cause of ulcers is a bacteria called Helicobacter pylori or H. pylori. This sneaky microorganism infects the stomach lining, leading to inflammation and ultimately ulcers. It's believed that up to 60% of the world's adult population harbors H. pylori. Have you ever heard of H. pylori? Let us know in the comments below if this is news to you. Another significant cause, overuse of NSAIDs like ibuprofen or aspirin. While these medications are effective for pain relief, taking them too often can erode your stomach's protective lining, making it vulnerable to acids. Raise your hand in the comments if you're a frequent NSAID user. While lifestyle factors don't directly cause ulcers, they can certainly aggravate them. Stress, smoking, and excessive alcohol consumption can make your body more susceptible to H. pylori and increase stomach acid production. Let's dive into how you can tell if you have an ulcer. One of the primary symptoms is a burning pain in the stomach. This pain often appears between meals or at night and can last from minutes to hours. It might even wake you up. Other symptoms include bloating, heartburn, nausea, and in severe cases, vomiting or black stools, which indicate bleeding. Have you experienced any of these symptoms? If so, it might be worth a visit to the doctor. To confirm an ulcer diagnosis, doctors use several tests. One of the most common is an endoscopy, which allows doctors to see directly inside your stomach. Another non-invasive option is a urea breath test, specifically for detecting H. pylori. If your ulcer is caused by H. pylori, your doctor will prescribe antibiotics to eradicate the bacteria. A 2-week course can typically do the trick. Next, to give your ulcer a chance to heal, doctors often recommend acid blockers or proton pump inhibitors (PPIs). These medications reduce stomach acid, giving your body time to repair the damaged lining. Do you have experience with acid blockers or PPIs? Share your experience in the comments. Treatment isn't all about medication. Simple lifestyle adjustments like eating balanced meals, avoiding trigger foods, managing stress, and cutting down on NSAIDs can be incredibly beneficial. Let's cover some natural remedies. Foods like ginger and honey are gentle on the stomach and can help reduce inflammation. However, be cautious with myths. Not every so-called natural remedy is backed by science. Preventing ulcers is often about practicing good hygiene, especially with food, and making balanced choices. Regular hand washing can reduce your risk of H. pylori, and moderation in alcohol and NSAID use is essential. Let's quickly debunk some common myths. Myth number 1. Spicy food causes ulcers. While it can irritate an existing ulcer, it doesn't cause one. Myth number 2. Only older adults get ulcers. In reality, ulcers can affect anyone. If you're experiencing severe symptoms, don't wait. Blood and stools, persistent nausea, and weight loss are all signs you should consult a doctor immediately. Ulcers can worsen without proper treatment. Thank you for joining us on this in-depth journey into understanding ulcers. With the right information, you can take control of your health, prevent ulcers, and treat them effectively. Don't forget to subscribe, hit the bell icon, like, and share this video with your family and friends.